All right, good morning and welcome to our meeting. Today is March 14th, 2024. We are in person as well as virtually at the Washington State Liquor Cannabis Board at 9:33 a.m. Today's meeting will be recorded. To better manage our meeting, if you wish to provide a public comment, please raise your hand to be recognized. Once recognized, please state your name. Written comments on today's agenda items should have been received by email or on our website by close of business yesterday, March 13th. And we did not receive any comments in the last few days. So the chat feature has been turned off. If you have technical difficulties, please email us at askus@wsgc.wa.gov. We will be going into executive session at around 11:30 today, and that will last approximately 2.5 to 3 hours. We will come back to adjourn. I will call the roll. Mr. Sizemore, get ready. All right. And then we have Commissioner Patterson here and Commissioner Ibsen. Here. Commissioner Lawson. I don't think she's potentially trying to join us, so we'll check in a few minutes. Senator Conway. I don't see him. All right. Senator Holy. Representative Kloba. And Representative Robertson.
Sure.
Good morning, Representative Robertson. Welcome to our meeting this morning. All right. So now we will move to tab 1, which is the consent agenda with the February 8th minute meetings, new licensees, and the House Bank card room list. Is there any public or any comments from the commissioners? Any public comment? All right. Do we have a motion?
Sure, I move to approve the consent agenda as presented by staff.
Second. Been moved and seconded. Is there any further discussion? Okay. All those in favor say aye.
Aye.
Aye. Aye. Any opposed? Motion passes. All right. Next up, we have a presentation regarding Problem Gambling Awareness Month with Roxanne Waldron and Maureen Greeley. Are you both here?
Chair, while they're setting up, might I just give a brief director's report?
Yeah.
Which flows right into the presentation. March is Problem Gambling Awareness Month, and we did have our second meeting of the Disordered Gambling Advisory Work Group just this last week. I think it was Tuesday. So just to give you an update on that work group's activity, we talked about the GRIT Act. We received an update on that. It's most likely not going to pass this legislative session, but the National Council on Problem Gambling has dedicated a page on their website to the GRIT Act, so various organizations can show their support. And so at the next meeting, I can present that to you if you want, and you can decide if you want to add your letter of support to that website moving forward, if that is something that you're interested in. Yes.
Madam Chair. With regard to the GRIT Act, and I see we have Representative Robertson. Are you still here?
I am.
My old friend, how are you doing?
Very well, thank you.
Yes. So this GRIT Act is a really well thought out list of recommendations for states to consider regarding problem gambling. And I'm wondering if you might just consider the idea of taking a hard, long look at it to see if maybe the House would consider passing a resolution supporting it. I wondered if you would take a look at it.
Absolutely, I'll certainly do that, and I'll get back to you.
I think that if the state did that, it would be really powerful powerful for this organization, and probably you get every other state in the nation to follow suit, I would imagine. Thank you.
You bet.
And I'll ask Senator Conway, if he shows up, if he'd consider mirroring you over in the Senate, if you want.
Yeah, absolutely. We do a lot of work together, so that would be great.
Thank you. Thank you, Madam Chair.
So I'll go ahead and get that information out to our ex officios as well then. Roxanne Peterson, the program manager for the state's program on problem gambling, provided updates, and not to get into too much of what she's most likely going to share in just a few minutes, but did state that Medicaid is now covering problem gambling treatment in the state, as she's mentioned before. But just for awareness, this frees up monies provided by the state problem gambling program so that certified program managers, certified gambling agencies can use the state program problem gambling program monies to provide more services to individuals and also to certify more treatment providers in the underserved areas that were pointed out in the problem gambling task force's recommendations. And so some agencies or treatment providers are reporting moving about 20 to 50% of their participants to the Medicaid coverage. So that is freeing up substantial amounts of monies for further use. And so I get impressed by that number. There are still some gaps that need to be addressed, such as in this new program, such as the sole providers are not able to use the Medicaid coverage. And then there's not a behavioral specialist, but there's something to do with case management that I'm sure that Roxanne will get into more detail about as well. The state problem gambling program has increased their rate for reimbursement. It's first time, sounds like ever. Increases for providers went up, for some services went up anywhere from 25 to 56%, depending on the service, which helps bring rates closer to market conditions, except depending on the geographical locations. The state program is also now part of a statewide prevention consortium with 6 other state agencies here in Washington. And so the Healthcare Authority will be participating in future statewide prevention plans. And is also working with the state workforce development to identify or to work with those high risk groups to find certified gambling counselors and find more certified gambling agencies, again, especially in those underserved areas. The goal is to try to have providers within 1 hour of residents within the state of Washington. And Evergreen Council Problem Gambling is offering scholarships to help with addressing the workforce development needs to bring more certified gambling counselors and get more certified gambling agencies on board in the state. The advisory work group agreed to keep the National Council of Legislators of Gambling States Responsible Gaming Resolution at the forefront of their minds with the work that the advisory group does. And that was based on your recommendations. And so that was a step forward. There was information that was shared. The National Council has a new phone number that you'll see in their publications. They have purchased the rights for a period of time for that number. The state also has a number, which is also outlined in our RCW 946-071 has that state number in it. So the numbers are different. The state number is different than the national number. And what I have gathered from Evergreen Council and from the members of the advisory work group is they want to make sure that this national number is going to be in existence for a period of time before they decide to adopt that national number, because of all of the time and expense to change materials if we were to adopt it. And then once they go to renew that national number, if for some reason they lose it, that would cause some setbacks. And then lastly, the work group has developed a tracking mechanism to track the progress or address challenges for all of us who are trying to achieve the Problem Gambling Task Force's recommendations that were outlined in the final report. So this way we'll have a tracking mechanism and be able to show the work that each of these agencies and groups are implementing in order to accomplish the recommended outcomes. And with that, that's all I have.
Question. Yes. Thank you, Madam Chair. So my question, it's a rhetorical question, but if the rates have increased by, you said from 25, this is provider rates. If they've increased from between 25 and 50% is what you said? 56%?
56% is what I had.
I mean, I know that those people that do that work need to be paid well, and I don't think they are paid particularly well, but it really begs the question, the extent to which that increase will affect our desire, our hope, our vision for providing more treatment opportunities. And I don't know if someone could address that today or not, but.
And maybe I should clarify just to make sure. The state's problem gambling program increased their reimbursement rates by 25 to 56%.
Oh,
To providers.
oh, thank you for clarifying.
Yeah,
Okay, then I was not understanding.
sorry about that.
But
So
nevertheless, it still takes that much more out of the state program, which I think that you can't criticize that way of spending the money. I'm just thinking out loud, but still it makes me wonder the extent to which the state could expand its treatment and prevention program. Rhetorical question, hopefully somewhere along the line we can get it answered. Yeah, thank you.
So, and if I can follow up on that, I thought I heard you say there was a pretty dramatic shift of folks into Medicaid,
yes,
which would reduce the amount of the state, what we have historically used for this treatment, right?
so yes, there's a shift. Some treatment providers are reporting moving 20 to 50% of their participants of the program to Medicaid coverage, but they're using then that gap to either provide more services
Right.
and or to seek new certified treatment providers, because there is a vast need, particularly in certain areas of underserved communities. So they're using that to expand their services.
And are we fully implemented to the 0.26? And I don't know whether
July
coming up.
24, it goes up to the 0.26.
Okay,
July
so
1st, 24.
essentially doubled the resources over a few years. We're now getting people into Medicaid, so we must have a much broader, and I'm sure the presentation may go into this a little bit, but seems pretty easy. It's a lot of work, a lot of work,
Yeah,
a lot of work that's gone into that.
Things have improved tremendously with the state.
Well, I'm sure that Tana and Roxanne have much more to offer too.
So hello, my name is Tana Russell. I am the Deputy Director of the Evergreen Council on Gambling. My background is as an addiction specialist. So I have been working with populations mainly dealing with addictive disorders since about 2007. I have been with, thank you. Do I need to repeat that for the people online? Okay. Give my introduction. My name is Tana Russell, Deputy Director. I have been with the Evergreen Council on Problem Gambling now since 2019. I am the co-chair of the Washington State Gambling Counselor Certification Committee, and I primarily focus on training. So when we talk about training therapists and counselors to be certified gambling counselors, I'm one of the leads who will be training them to do that work. And we have maintained the Washington State Problem Gambling Helpline, the 1-800-547-6133 number, for over 30 years now. So I'll be talking to you a little bit about Problem Gambling Awareness Month and what we're doing there. And I will also be closing with kind of circling back to this conversation of reducing barriers. So I'll come back to that that's my last slide. We'll get to more details on that. And then Roxanne will follow up. All right, so the Evergreen Council on Problem Gambling, we are a nonprofit. We have been around about 33, 34 years. We are neutral on gambling, but we do believe that for those who do suffer, and while most of the population can gamble and game without serious problems from it, for those who do, it can be quite devastating, even life-threatening. And so we do believe that help should be available to anyone who needs it as quickly as possible and in their language. Go ahead. So for Problem Gambling Awareness Month, March is National Problem Gambling Awareness Month. The theme is Every Story Matters. You may have been seeing some of ECPG's. We call it PGAM for short. So if I say that, that's just the acronym. You may have seen some of our PGAM campaign elements going around, and you can go to the next slide. Governor Inslee has proclaimed March as Problem Gambling Awareness Month in the state of Washington. And you can go to the next slide and I'll cover some of the things that we have been doing this month. We did have a live stream this last February, which you can watch on demand either on Facebook or YouTube, with Dr. Debbie Haskins and Dr. Carmela Washington Harvey. And the subject was Problem Gambling or Solution Gambling, how to support Black communities, cultural realities. So I got to interview these experts. They have been in this field for several decades. And they offer a really lot of great insight on that episode. And on the next one is our podcast. We have a podcast called the Connections Healthy Gambling and Gaming Podcast, where we cover all things related to not just problem gambling, but also responsible gaming and video gaming topics, even related to metaverse or equity in gaming and everything in between. Our two episodes coming out here soon. One is Recovery One Day at a Time with Rob Minnick. You can follow him on various social channels. And another one we're going to be recording tomorrow and coming out in a few weeks on raising awareness in Black communities with, now, at the time I created the slides, we didn't have our guest confirmed, but it'll be Chandra Parks with the Maryland Council on Problem Gambling on that episode with us. And then on the next slide, if you could. Thank you. This last Tuesday of this week was National Gambling Disorder Screening Day. And all this is basically to try to get gambling screens as easily available to people as possible. Of course, for those who work in this field, our hope is that for facilities who embrace this, they will then continue to do it every day of the year and not just on Gambling Disorder Screening Day. But again, it's in this spirit of trying to make access to help as easy as possible. So it's easy screening tools and referral resources. And you can see an example of Tulalip having a Gambling Disorder Screening Day at their facility. We now have an e-screener on our website open to anyone if they'd like to take a screener online and just get some feedback about it real quick. And you can go to the next slide. Also, I don't know how many of you watched the Super Bowl this year, but we have had a Super Bowl or a sports betting awareness campaign running since last year. And we also released some articles and things leading up to the Super Bowl. And just in case you're interested, I did pull some of the betting reports from ESPN. Of course, sports betting has been going up every year for the last several years. And this year for 2024, there were 68 million adults betting and $23.1 billion bet. Compared to last year, it was 50 million adults and 16 billion bet. And next. So our sports betting campaign, it's running right now, January to May.
And our communications manager did give me a little bit of stats on how it's performing. Compared to last year, we're seeing 112% increase on views so far and 155% increase on viewers. So it is being seen. You might have seen it or heard it on some of these channels or OTT streaming ads, etc. But it is heightening awareness, and it can also translate into calls to the helpline as well. And next slide. So lastly, this is circling back to that conversation we're having just a minute ago about reducing barriers. So one of the things that we are trying to focus on is increasing access to services for those who are trying to find it, and also increasing the workforce to meet that need. For access to services, we do have the online website directory, the helpline, which you saw on screen earlier and we've talked about. Those are available 24/7. Easiest one-stop shop for anybody to call, text, or chat and immediately get referred to certified gambling counselors near them, as well as GA and Gam-Anon meetings and other things. And of the certified gambling counselors in our state, about 95–98% of them also do telehealth. So they do virtual services as well. We are almost launching a problem gambling training for financial advisors, so that those who are having financial difficulties related to gambling, who want to go get financial advice from a certified financial planner, etc., can get that advice from someone who understands the impact of gambling disorder on the finances and gambling triggers that they'll need to be protected from. So that's coming out this year. And also culturally trained and diverse providers, of course, is always a great need. For workforce development, there is this, think of it like a golden thread from a person's journey to specializing in this field. First, they have to go to college and get their degree, right? That license that then allows them to get the state license through the Department of Health. And then that allows them to get this specialty add-on license to be a certified gambling counselor. So we have funding to help support students, undergrad, graduate, PhD students with the college degree portion. We also have funding for the training. Some of this training scholarship comes from the Healthcare Authority, some from the Recovery Cafe Network. This helps cover the cost of the specialty training on gambling disorder. It also covers a portion of a hotel stipend, and for those who are becoming treatment counselors, certified gambling counselors, it also covers that certification application fee. And once they are now providing those clinical services, Roxanne also has treatment reimbursement, but ECPG, we have treatment reimbursement. So she'll talk to you about hers in a minute, but we have also raised our treatment reimbursement rates to help pay for the services provided. And gambling disorder by its very nature generally leaves people broke. They just cannot afford treatment, understandably. So these funds help cover that so that the providers can still get paid for their work, and also to help reimburse them, because they often pay out of their own pocket to work with a supervisor, to supervise their work as they're new to it and learning the process. So we try to help support individuals through that whole thread from college to certification to practice. Oh, and the case conceptualization, this is something the Washington State Gambling Counselor Certification Committee created a few years ago. Anybody who gets this specialty certification does have to pass an exam. Exams are not necessarily the best measure of a person's counseling skills. Also, there's test anxiety, and for people whose first language is not English, that can be a barrier. So the case conceptualization is something they write out and then is reviewed by a panel of 3 and scored with the same scoring threshold as the exam. So that is all I have for you. If you have any questions for me, please feel free. And then Roxanne is going to be talking to you next about her program.
Good morning. Let me just get my PowerPoint set up and then we'll get started.
Oh, is there a question from Steve Conley?
Oh. Sarah Conway, did you have a question for
Yeah, I had a question about the training of our counselors and whether they're integrated into the behavioral health system. You know, or whether they're a specialty beyond that. I just guess my question is about how the training of our gambling counselors is tied into the behavioral health field. Because, you know, so often these problems that problem gamblers have are related to other things as well. I guess that was my question. It seemed like we have a very specialized training going on, and I'm curious whether it is integrated with the behavioral health training.
Well, thank you. I cannot speak for all college and university counseling and behavioral health programs, correct? But through the counselors and therapists that I do work with on a regular basis, the consensus seems to be that in those higher education programs, if gambling disorder is covered at all, it's very low. So it may be a guest speaker talks for 2 hours out of a 2 to 3 year program, and that's it. So the amount of training they get within their college programs seems to be quite little, and some will say none at all. The specialty training program is 30 hours, and it does not train them how to be counselors because they already went through that and they should already have that license. It teaches them how to apply that work as a therapist or counselor that they already have to working with clients with gambling disorder. Now, in terms of general integration, problem gambling integration for behavioral health programs is one of my most requested topics. If I'm presenting at another conference somewhere, that's very often one of the topics that's being requested, because there is a lot that those in behavioral health programs can do without having a certified counselor on staff. They can screen and they can refer to specialists. They can provide education. They can provide case management. They can do outreach and engagement with their communities. There's a whole lot they can do to integrate to a degree and make sure that people feel safe to talk about that, and where needed, then refer to that specialist who can do the actual treatment piece for that. So we're trying to integrate it as much as possible, and it is something that I think the need for it is being seen more and more.
Yeah, the other question I have here is wouldn't it need to be integrated to get Medicaid reimbursement?
Yes, and I will let Roxanne Waldron talk about that in a moment, because I think Medicaid is on
I'm-
her.
You have people got to realize I sit on the healthcare committee, so I basically get a lot of exposure to healthcare training, and I'm a little bit surprised that it seems like we need to get it integrated. That's all. I mean, to me, gambling disorders have a lot to do with other problems that people have as well, whether it be whatever it might be. But it just seems to me that needs to happen. Thank you.
I agree. Thank you very much.
One more question.
Oh, that's it.
Yes, Tana, could you remind us, generally speaking, again, just give us an idea of where the Evergreen Council's funding comes from?
Yes, it comes from a variety of sources, including tribes, including state contracts, including fee for service for different things. The tribes being probably the largest portion.
Can you give us a general idea, percentage-wise, where the funding is coming from?
I cannot off the top of my head. Maureen would be the one who could right off the top of her head. I don't know if she's tuning in, if she can answer that, or if it's okay, we could follow up in an email.
I think it would be good for the public to know.
Yeah.
So
Yeah.
if Maureen is here, that would be good to know. Or maybe you could give her a call. Is that possible?
I can.
Okay.
I can. Are we able to circle back after a break or something? Would that be okay?
Sure. Thank you, Madam
All right.
Chair.
Perfect. Thank you.
Thank you. Roxanne.
Hi. Thank you. So I will be presenting in just a moment, but I want to thank you, Chair Levy, and commissioners and ex officios for having me present today. And for the record, I'm Roxanne Waldron. I'm the State Problem Gambling Program Administrator within the Division of Behavioral Health and Recovery at the Healthcare Authority. And I do want to say also that our program is also neutral on gambling. We provide services to individuals and their loved ones who are negatively impacted by problem gambling. I know that there were a couple of issues that were raised. I'm thinking it might be good to address those now before I do my presentation. In terms of the training and integration, that is one of the recommendations that was in the Problem Gambling Task Force report that went to the legislature in December of 2022. So it is within the purview of the advisory committee that was created to track those recommendations. It's called the Disordered Gambling Advisory Work Group. And so we will be tracking how that's happening. We will be brainstorming about next steps on that. So I just want to make sure that that piece is not lost. It is actually on top, at top of mind for that group and for me. And then in terms of Medicaid and being integrated. So the way it worked with Medicaid, and I'm going to talk a little bit more about what's available, but with Medicaid, the state plan amendment to Medicaid was approved by the Centers for Medicare and Medicaid Services. It was in that process, the state needed to define what kinds of clinicians could provide these services. And so that is defined in the state plan now. And in terms of integration, most of the people, people that are providing that service, they're either already licensed mental health providers of some kind and or substance use disorder professionals. So they are already, that work is already integrated in terms of their practice. In terms of what agencies are doing, that is a piece that we are moving forward on and will be working on over the next, 3 to 5 years and going forward. So I'm just going to stop there, and hopefully that answered a few questions. I'm happy to take more at the end if there's time. So Tana just covered Problem Gambling Awareness Month activities, so I'm not going to go into any detail about that. We have a few things we do at HCA, but not the scope of what the Evergreen Council on Problem Gambling does. We will be expanding our scope now that we have some additional funding. So I'm going to instead share a few updates about work that's happening in the state problem gambling program. And this work is the result of a lot of hard work on the part of many partners, including current and past commissioners and ex officios over the past 5 years, especially, and before. So in response to the Problem Gambling Task Force's final recommendations report, which I mentioned, which was delivered to the legislature in December of 2022, so a little over a year now, 2 companion bills were introduced in the spring 2023 legislative session by Senator Conway, who is here, and also by Representative Stearns, who is a former commissioner. So both bills moved through the legislature with bipartisan support, and the Senate version did pass. It was signed into law by the governor, and it took effect on July 1st, 2023. So that bill specifies the following changes to the state problem gambling program. It increases funding for the program in 2 steps, and I think Commissioner Sizemore, you had asked this question. It is 55% in the first fiscal year, and the rest starting on July 1st, 2024. So that doubles the funding for the program going into the 2025-2027 biennium and beyond. So we're still in that ramp up period. So the funding, just to remind folks, is based on the business and occupation tax increase to commercial and charitable gambling, and an increase of the contribution from the lottery by the same percentage. It requires, another aspect of the bill is that it requires HCA to create a year-round problem gambling prevention program that is integrated with other behavioral health prevention efforts. And it also initiated the committee that I mentioned, the new committee to track implementation of the Problem Gambling Task Force recommendations. And it's called the Disordered Gambling Advisory Work Group, or the DGAW, with HCA is the lead agency on that. So I'm facilitating that group. This work group held its first meeting in November. It had a second meeting, as Director Griffin mentioned, on this past Tuesday, and will be meeting quarterly going forward. So in addition to the changes from the legislative bill, also HCA did receive approval from the Centers for Medicare and Medicaid Services to cover problem gambling assessment and treatment under Apple Health, which is Medicaid in Washington State. And the legislature also in spring of 2023 had approved the Medicaid state matching funds. And so as of January 1st, 2024, billing for problem gambling treatment services is now underway under Medicaid. So next, I'm just going to share a little more detail about all of those. For the problem gambling prevention expansion, the new legislation required, as I mentioned, the HCA launch an integrated year-round prevention program with community involvement. So to help guide this work, we formed the problem gambling prevention work group, which is now meeting every other month for about 15 more months through June of 2025. It includes HCA staff from Division of Behavioral Health and Recovery and the Office of Tribal Affairs. It includes Gambling Commission, Department of Health, and OSPI, the Office of the Superintendent of Public Instruction partners, also gambling clinicians and prevention specialists. So the facilitation for that group has been funded by the Recovery Cafe and the Snoqualmie Tribe, for which the program is very appreciative. The focus of the work group is to help guide and provide feedback on the statewide problem gambling prevention program that we're designing. And the goal is that it will be included in the statewide prevention plan for all topics in 2027. They update it approximately every 5 years, and it just went through an update recently. So the primary focus for the problem gambling prevention work within the Healthcare Authority is youth and young adults, at least initially. We're also, the state program is also coordinating and helping to fund with the Evergreen Council additional media and outreach campaigns that focus on Black, Indigenous, and people of color, women, and the military. That's the current biennium. We'll be having additional focuses in the future. And we'll also be reaching out to tribal behavioral health agencies with robust problem gambling programs to learn more about their practices for community engagement, because that's a piece that is really new for our program. So next we have that workforce development piece that we talked a little bit about, Tana touched on. So again, the Problem Gambling Task Force recommendation report identified gaps in state certified problem gambling treatment services. And in this context, state certified means for sole proprietors or providers that the service provider is a certified gambling counselor or a certified gambling counselor in training that has appropriate supervision as defined in the WAC. So for behavioral health agencies, state certified means that the agency is a licensed Department of Health certified problem gambling agency, which means it has to employ or contract with at least one certified gambling counselor or one in training with appropriate supervision. So the identified gaps included, we found at least 11 geographic regions across the state that had no state certified problem gambling services within a 1 hour of drive time. And some of these have commercial and or tribal gambling nearby. There were a lack of clinicians who speak languages other than English, especially for populations known to be at increased risk for problem gambling. And this includes Spanish, Korean, Vietnamese, et cetera. And then there was a lack of PG services, problem gambling services within communities that are at populations that are at a higher risk for problem gambling or gambling disorder that also don't have problem gambling services within those communities. So again, this would include the Black, Indigenous, and people of color communities, communities with low socioeconomic status, and for the social determinants of health, there would be a lack of good access to healthcare, education, healthy environment, and food, and so on. And then finally, the lack of clinicians with lived experience within those communities or from those communities, because we know that often people feel more comfortable talking to someone who looks like them and or has had similar life experience. So here's the map that shows the 1 hour drive time regions of the state, which have a gap in services that we are focusing on to increase access to state certified problem gambling treatment services. So what is highlighted on this map are the geographic areas that we have gaps. Not highlighted on this map are the areas where we need certified gambling counselors who speak languages other than English and or have lived experience of communities that are at higher risk for problem gambling that are currently served. So there are more places than just what's on this map. This just gives you the geographic idea. So to fill these identified gaps in the state certified problem gambling provider workforce, and I know Tana touched on these, so I'll just go through them quickly. The State Problem Gambling Program and the Evergreen Council have launched a workforce development initiative. So we're using a multi-prong approach, and all of these are available to tribal and non-tribal behavioral health agencies. We are training additional certified gambling counselors to fill those gaps in region, language, and lived experience. We are doing outreach to existing DOH licensed behavioral health agencies to urge them to identify one or more clinicians that they're currently employing to become certified. We are encouraging agencies that accept Medicaid to employ, train, or contract with new and current certified gambling counselors. We're also offering the enhanced scholarships that Tana had mentioned, up to 100%. For training and supervision to become a certified gambling counselor to fill those needs. And that is open both to individuals who want to become certified gambling counselors and also to agencies that wish to train counselors. So as of January 1st, 2024, with the additional funding, as was mentioned, the State Problem Gambling Program increased our treatment reimbursement rates by 25 to 56%. And the difference is some were at a higher rate already, others needed to be brought up. So the most significant change is we changed the hourly rate for encounters for individual, family, and couples from $80 an hour to $125 an hour. So that was the biggest jump, bringing us much closer to market. And it's also in line with what Medicaid is paying now. So we've done a job of really working to coordinate those payments, to be very similar. And then we're also accepting applications in the state program. I'm accepting applications for agencies or individuals that want to contract for problem gambling treatment reimbursement. I haven't had the opportunity to do that before because we didn't have adequate funding to expand that, but we do now. And so far we've added one contract already in February, have a couple more agencies that are interested, and we haven't even done a big reach out yet around that. So that's exciting. So the last update is the coverage for problem gambling treatment services in the problem gambling task force report. So as of January 1st, the problem gambling has been added to Medicaid billing guides for both managed care organizations and fee-for-service clients. Billable services under Medicaid include assessment and individual, conjoint, family, group sessions. There is no case management or supervision included in that. Case management, if the service is provided by an substance use disorder professional, they can use the coding for case management under SUD. And then behavioral health agencies that accept Medicaid and are problem gambling certified by the Department of Health are eligible to submit billing. So this includes both tribal and non-tribal behavioral health agencies. Again, as was mentioned, sole providers, that is certified gambling counselors that are not affiliated with an agency, they can't bill yet. This is HCA, we're working on how we can expand this billing to sole providers under Apple Health. This has to do with the state Medicaid plan and the portion that was changed to allow this service. And then the state program, which I manage, will continue to serve non-Medicaid eligible clients. So for our problem gambling contracted agencies, as of April 1st, 2024, we're requiring all Medicaid enrolled clients that they should be moved over to Medicaid. So to access services, individuals can contact the problem gambling helpline for referral or assessment at the 1-800-547-6133 number. And here's my contact info along with the problem gambling helpline again. And clients can also reach out to me directly or the Evergreen Council on Problem Gambling. Together, we support a no wrong door policy. Come in wherever you can. And so thanks for the opportunity to present today. I think I might be over time, but I am happy to answer questions if there are any.
Great. It looks like we have a question from Senator Conway.
Yes.
Yeah, my aide told me that there was an answer to the question I had. During the Super Bowl season here, I was listening to the Puyallup. They had some great problem gambling presentations during those games. They did a great job. I was very impressed by them. But I noticed that they were referring people to the national line instead of the state line on problem gambling, and I just kind of alerted me to the fact that there's a little bit of confusion out there as to what line should we be using? Should we be using the national line or the state line of problem gambling?
So the fact is that that will lead you to the same place. The national line will be referring you to the state lines. Unless there is a state that does not have its own state line, then they will be referring you, I believe, and maybe Tana can confirm this, to the same place where all the other state lines, many of the other state lines end up anyway, which is the Louisiana Council. So we have the Evergreen Council in Washington State. There's the Louisiana Council that's at Louisiana, but they are a clearinghouse for referring to other states for those states that have contracted with them,
good.
which includes Washington State. So it's all in the same path. So I think what Tana was referring to is not so much that we're going to replace our line, but we just want to be a little bit careful about publicizing the 1-800-GAMBLER number to make sure that it is working to transfer calls to us. Does that make sense?
That makes sense.
Okay.
The other question I have, Roxanne, great
Yeah.
presentation, by the way.
Thank you.
You know, I need to get together at some point.
Yes.
Now that I'm free from the legislature, perhaps we can do that. But I was curious, do you have a financial statement in terms of the dollars that are coming in, the dollars going out? Have you, does your group have the advisory group get a financial picture of where we're at?
That would be a great thing to do. I actually have that on my to-do list to request that from our accounting division. So I'll follow up on that, and then I can share that with the Disordered Gambling Advisory Work Group.
It would be a value, because then we can know, you know, what we may be needing to do on this area. So thank you.
Yes. But essentially, we're moving, just a quick overview. So we've been at about 1.4 million for since the beginning of the program, up or down a little for each biennium. So that was around 750,000 per year, compared to, let's say, Oregon, which has 10 million a year, for example. All depends on how the state sets it up, right? So now we have moved to 2.8 million, which will be doubling. So we'll have the 1.4 million per year roughly. So a lot of the work that I'm working on now with our partners is to expand, use that money to expand services we haven't done before, and then make more robust the services we do have.
Thank you.
Thank you for the opportunity to share.
Thank you. Any other commissioners have questions? All right, well, thank you, Sam.
Thank you.
And
Chair, I do see that Maureen Greeley is on camera. Do you, she may be wanting to respond to your question.
okay. Hi, Maureen. Were you here to respond to a question that was asked earlier?
I am. I heard that there was a question about percentages of funding to our nonprofit organization.
Yes, thank you.
Absolutely. For the record, Maureen Greeley, Executive Director of the Evergreen Council on Problem Gambling. I can give you broad percentages, given the amount of time that I just found out about this. I can't drill down real far, but I can tell you that of our annual budget for our last audited budget period, which was the year ending December 31, 2022, because we're in our current audit for 2023, 63% of our funding came from tribal contributions, individual contributions, and corporate. Now, while I don't have the exact amount, I will tell you that the bulk of that is going to be from tribal contributions. 25% of our funding came from contracts. That would include our contract with the Washington State Healthcare Authority, individual tribal contracts for services outside of X2 amendment funds, and contracts with other states and other programs. And about 12 to 13% comes from our own program fees. For instance, we do 4 different training conferences each year. There is a fee to attend those. So when we have fees for our own services, then we put those in our program fees. So that's a broad breakdown. I'm happy to come back again in the future and give you more detail if you'd like that, but I hope, Commissioner Patterson, that might help with your questions.
Thank you, Maureen. It would be interesting to know of the 63%, what percentage is coming from corporations, individuals, and tribes, but I know you don't have that today.
I don't, but I would estimate just off the top of my head that of that 63%, probably about 2/3 of that is coming from tribal support. And again, don't tie me to that number, but that's what I would estimate just off the top of my head. The bulk of our funding does indeed come from support from tribal nations through their X2 compact amendment funds.
And has funding been stable, going up? How is funding going?
It varies every year. Because as you know, tribal nations can choose where to give their funds, and some of them use the bulk of their funds for some very strong programs they offer themselves. And so every year our tribal funding can vary substantially, but we have seen fairly consistent support since the tribes began providing funds for this program through their X2 amendments.
Thank you.
You're welcome. I can tell you our total budget, just to give you an idea of what that 63% represents, ranges, this is where it does, excuse me, does vary every year, ranges from about 750,000 to $1 million. So there is a variation of up to 250,000 in any given year, depending on what types of contracts, programs, and services that we receive funding for.
But again, your funding is keeping pace with inflation.
I can't actually say that's always true. No, some years yes, some years no. During COVID, obviously, we took some big hits, but we're starting to get some momentum again and seeing more contributions coming in the last year and this year.
Thank you.
Thank you, Maureen, for coming on so quickly and answering that questions. And I see that Roxanne, your hand is up. Do you have more to add to that?
Yeah, I just wanted to clarify something that I said because it could be, I said it correctly, but I want to make sure that the intent is there. When I said that Oregon has like 10 million or other states have more, I want to clarify, first of all, there are states that have no funding at all. So we are very grateful for funding. Secondly, what I was reporting is the amount of our state funding that we have coming in from commercial gambling and the lottery. There are 3 to 4 million that's coming in annually from those X2 funds that Maureen was talking about that is available within the state to the Evergreen Council to use within the tribal behavioral health programs and other programs. So if you add that in, it's actually much more significant across the state. The piece that we don't always know is how, exactly what the tribal funds are going for. But in terms of what I'm focused on, it's how we're running our state program. So when I say we'll have 2.8 million, I'm referring to what the state program will have for the biennium. So I just wanted to clarify that we do appreciate the work our tribal partners are doing.
All right, thank you. Thank you, Hannah, Roxanne, Maureen. We appreciate all the good information today and appreciate you joining us. I think now we will move, or I believe Commissioner Lawson may have joined. Are you here, Commissioner Lawson? Maybe not. All right. We will go ahead to tab 3, which, is that? Hello, Commissioner Lawson, you are here. Good morning, welcome.
Good morning. I wasn't able to unmute myself when you first asked, but I've been given that ability now and I'm here.
All right, good morning, thank you. All right, and we will move to tab 3, which is the legislative update.
Thank you, Chair. Commissioners, so there were no gambling bills specifically that passed during this legislative session, which ended last Thursday. There was to report back in terms of the 2 bills that the commissioners chose to support. One of the bills did pass, and that has been delivered to the governor, and that is concerning animal cruelty in the 1st degree. And so watching for the signature of that.
I think that signed yesterday.
Signed yesterday.
Okay, very good. So that was a nice, that will help because that assigns a level 3 seriousness to animal cruelty cases that inflict harm or injury or even death to illegal animal fighting events. So that will be helpful. So just a few other bills. I listed a few that have impact to the agency in various capacities. One is House Bill 2216 that eliminates the 2-year and 4-year degree requirements, unless the degree is required by law for an employee to perform their essential functions. And so we'll be watching that. Again, all of these bills have been delivered to the governor. And so that may, I think that was moved forward as an opportunity to help remove those potential barriers of entry to the workforce. And so we'll be implementing that, as well as eligibility for employment of certain law enforcement agencies. And so that does include limited jurisdictional agencies as well. And so we'll be able to, moving forward, consider applications from citizens as well as lawful permanent residents. And then there was a bill that provides flexibility for general and limited authority agencies, peace officers, when feasible. So we can adjust work schedules beyond full time, because specifically in the statute, it said it had to be full time in general authority and limited authority. But again, alternative work schedules will be something that we potentially explore, but it does need to fit the needs within each law enforcement agency that decides to move forward with that. And then there's one bill that we'll be seeking guidance from, and we'll hear more about. Substitute House Bill 1105, requiring public agencies to provide notice for public comments. That includes the last date by which public comment must be submitted. And so we'll just be monitoring the signature of that and then providing updates in terms of how that might impact mission work and notices, etc. There's just a few more, but
We don't need to be the lead agency on that.
no.
This is, that is a bill that impacts the Open Public Meetings Act. And so this will be across all agencies.
And so at the May meeting, because at this point there's no June meeting and then July is right around the corner, we will be bringing topics for you all to, potential topics for legislative session 2025 for your thoughts and consideration. And we hope to hear your thoughts of potential legislation ideas, so we can have a brief discussion about that, because when we reconvene in July, we will need to know what items we'll be looking to you all to give us guidance as to what you would like us to proceed forward with, because then September is right around the corner from that. So.
Took my
Just-
summer.
I know. I'm sorry. Just the reality, Gremlin.
Okay. Thank you. Now we are going to move into our rulemaking. So the items on the agenda are the Commission's current rulemaking matters. These matters may be at different stages in the rulemaking process. If a rule hearing is scheduled, these will be legislative in character and are conducted to allow interested persons the opportunity to present comments individually. And we are seeking to have a more in-depth discussion amongst commissioners. Commissioners should not feel rushed to resolve concerns expressed during the rulemaking hearing today. You can ask that a rule be held over for further discussion to explore other options available to you as you contemplate how best to proceed with the rulemaking topic. The first rule that we have is nonprofit raffle rules with Adam. Morning.
Morning, thank you. There we go. Good morning. For the record, I'm Adam Amarin, a staff attorney and rules coordinator for the Gambling Commission. Turning first to the rules for nonprofit raffle prizes. This petition would amend several WACs that govern how nonprofit organizations can operate raffles and the prizes associated with those raffles. Since initial rulemaking was approved in September, staff developed the attached language in your packet, the attached rule language, I should say, that seeks to address both the petitioner's concerns and the staff's interests while maintaining adequate regulatory control. Now, the rule language in your packet did contain one small typographical error. We have updated you with a handout. That error was in WAC 230-11-065. And the adjustment is just making sure that the rule reflects the adequate or the accurate numbers under subsection C, which should be $60,000 per prize or $400,000 in total during a license year. Since our last time discussing this rule, we have received several comments in support of the rule, most recently from Matt Little, who represents 14 Washington nonprofit organizations, and also received a letter of support from an individual representing a nonprofit organization called Outdoors for Our Heroes. This rule is up for final action today. And staff would recommend that the commission take final action on the proposed amended rules after holding public hearing. And these rules would take effect 31 days after filing with the Office of the Code Revisor.
Thank you, Adam. Anyone have any commissioners have questions for Adam? No? All right, is there any public comment on this rule? Okay, not seeing any. We have a motion.
I will move, we take final action on the proposed amended rules as presented by staff, which include the increase in the total prizes in a license year from 300,000 to 400,000, WAC 230-11-065. The effective date of rule changes will be 31 days after filing with the Code Revisor.
Second.
Okay, it's been moved and seconded. Any further discussion?
Just a process question. So the motion included the recommended amendment. Is that correct? Okay.
Been moved and seconded. All those in favor say aye.
Aye.
Aye. Any opposed? All right, motion passes. All right. Next up, we have tab 5, which is a rule for final action regarding adjacent card rooms with Adam.
Yes, thank you. As you said, this rule will be regarding adjacent card rooms. Staff is suggesting amendment of WAC 230-06-4046, excuse me, and we're going to repeal that one. And replace it with a new WAC that is aimed at developing clarifying language to ensure that adjacent card rooms operate as separate and distinct licensed business premises. Staff also felt like this new rule would be better located in the licensing section of the WAC. At the last commission meeting, we had some discussion and received public comment from Eric Pearson of Maverick Gaming. We did want to mention a policy consideration with the language as it's written currently. If I could turn your attention to the last sentence in subsection 2, which states, quote, the provisions of subsection 1 of this section will take effect upon the issuance of a new license. Staff is recommending that we strike that one sentence from the rule language for 2 reasons. One, that sentence really regards a policy consideration that the commission last addressed in 2010 when they last visited this rule. And that was not our intention to address that policy when we brought up this rulemaking. Instead, our intention was to clarify the language and move it to a better section of the WAC. So with that, our recommendation would be to strike that sentence and refile a new CR 102. Alternatively, the commissioners may take final action on the rule as it's written right now, or take any number of different approaches.
Any of the commissioners have any questions? No? All right. Is there any public comment? No, not seeing any. All right, do we have a motion?
Madam Chair, let's see, is this a motion or is this discussion regarding the proposed exemption of language that staff brought up? Is there a motion that includes the striking of that language so that the policy does not apply to those who are licensed prior to this rule? I don't seem to have that. Is that here? Okay. I'd like to make that motion, Madam Chair. I move we further amend WAC 230-03-182 for further discussion and strike the last sentence of subsection 2. And it states the provisions of subsection 1 of this section will take effect upon the issuance of a new license.
Second that.
Okay, it's been moved and seconded. Is there any further discussion?
Question for staff. Timing wise with code revisers, just come back to us in April or May then?
May, I believe.
Okay.
All right, so it's been moved and seconded. All those in favor say aye.
Aye.
Any opposed? All right, motion passes. We are now going to take a 10-minute break. So we'll say it's 10:40 and we'll resume at 10:50. All right, thank you. We are back and we are moving into tab 6, which is problem gambling signage.
Yes, thank you. You might recall at the April 2023 commission meeting about a year ago, commissioners initiated rulemaking on problem gambling signage. After reviewing rules of other states and Canadian provinces, staff prepared the attached rule language that, if adopted, would become part of the commission's rule chapter that applies to all licensees. This rulemaking aims to address problem gambling by requiring licensees to display problem gambling signage at certain points in their card rooms and casinos, at all public entrances and exits, excuse me, in or near gambling areas, and in any areas where cash or electronic transfers of funds are available to patrons. The attached language would also require all advertising materials to contain a responsible gambling message. And it would require those advertising materials to contain a clear method of opting out or unsubscribing from those advertising materials. In January and February of this year, staff sought feedback on the proposed language from both the healthcare authorities problem gambling program and the Evergreen Council on Problem Gambling, as well as all licensees except for sports wagering vendors and individuals. Today, staff is recommending that we file the attached draft rule language for further discussion after holding a public hearing.
Thank you. Do any commissioners have any questions?
And again, it doesn't apply to sports. Oh, that's because they're tribal. Okay. Of course, this rule does not apply to tribes, but I am happy to see that we received an email from Jamestown Sklallam supporting the rule with a comment from Gideon Kaufman saying it would be helpful for the entire community of Washington.
Tribes already.
Pardon me?
Tribes already do.
Oh, that's awesome. So just heard that tribes are already doing this. That's good. Thank you.
All right, any other questions? All right.
Oh, I just want to say thank you to staff for this. There was a lot of work that went into this. And I think it's really a good rule. So probably unique in the country, I imagine. I don't know if any other state has very specifically outlined what it is that they want, but this is great. Thank you.
All right, is there any public comments? Seeing none, do we have a motion?
Madam Chair, I move we file the proposed rules for further discussion.
Second?
Been moved and seconded. Any further discussion? All right, all those in favor say aye.
Aye.
Aye. For Lawson, saying aye.
I
All right, motion passes. Thank you. All right, next we will move to tab 7, which is the minimum cash on hand with Adam again.
All right, so this minimum cash on hand requirements, this would regard WAC 230-15-050. You might recall at the November 2023 commission meeting, commissioners asked staff to work with stakeholders to determine if rulemaking could address stakeholder concerns regarding minimum cash on hand requirements for house bank card rooms. At the time, we heard from a petitioner who expressed concerns mostly revolving around safety for card rooms having a large amount of cash on hand, both due to the threat of the card room itself being victim of a robbery and due to the threat of a patron winning a large prize and then leaving the card room with a large amount of cash. The current rules require house bank card game licensees to have sufficient cash on hand to redeem all chips issued for play and pay out all prizes. These rules require $1,000 for each house banked table on the gaming floor, plus the amount of the largest single prizes available. However, these rules exclude progressive jackpots, player-supported jackpots, and house jackpots. In developing new rules for minimum cash on hand requirements, staff is weighing the concerns that were originally articulated by the petitioners, along with staff's concerns and really the public's concerns that all winning prizes are paid out in full and in a timely manner. Staff still does have some concerns in generating this language, but at this time we're ready to recommend rulemaking to amend the WAC and create new rules related to how prizes can be paid.
Thank you. Any questions?
So, and I'm not sure if you can articulate it fully, but can you explain to me, like, the agency, the staff's interest in players being able to be paid out in cash at the time of the win?
I don't know that the staff has interest that the players are paid out in cash at the time of the win. We're interested in making sure that they are paid fully. There are certain games such as the progressive jackpots that I mentioned, in which the patron is given $5,000 up front, and then the rest is made available to them in a check within 24 hours. These are rules that we don't necessarily have an issue with, but our main concern is making sure that the players are protected and that they get their the entire prize that they're entitled to, regardless of that method.
Is there anything more from, no? Yeah. Thank you.
All right, any other questions from any commissioners? Not seeing any. Is there any public comments? Yes, I see a hand. Is that Eric, please? We can't hear you, Eric.
Hi, sorry about that. This is Eric Person, owner of Maverick Gaming. I appreciate the moment in public comments. I just wanted to comment on the what's up in front of you currently, and I would just say two things. Like there's two things that are really important to Maverick. One is consumer confidence. People have to believe that and know that if they win something, they're going to get paid, and two, public safety. And so that's both my employees as well as the consumers who come into our card rooms. And I just don't want I would not like the output be something where require a customer, to have some large amount of cash. Like I know that Nevada's referenced as one of the comparison states in staff stuff. And in that state, for example, we're able to use like a line of credit or cash in our bank accounts as part of the cash on hand. Washington requires on the progressives, and I heard that out there, so $5,000 in cash and a balance to be paid in check. My experience is consumers really don't want more than they might want more than 5,000, but they don't I've never seen it where they really want more than say even 25,000. So I just don't want the output to be, especially on the lower earning card rooms. This will never be a problem for the card rooms that gross a lot. We carry far in excess of the cash on the minimum hand that's required, and that's because of the amount of volume that goes through our business. This impacts potentially the lower earning, lower producing card rooms. If they were to have to freeze up a bunch of cash in the building that they couldn't use for other uses because they could no longer pay with the check, it would probably harm them. I don't own most of the lower earning card rooms. I do own some. But my concerns are really about public safety, and I don't want an unintended consequence being that, we're required to carry a bunch more cash in our building that just puts everybody at risk to a greater extent. It's no secret there's been a lot of robberies, both in card rooms and tribal throughout our state over the last year and a half, and we don't feel like that's really going away. So I'm all in support of making sure that consumers always get paid, and that's so important that they have to have that confidence. And I just don't want to, put our customers, our team members at risk by some sort of change that actually does the opposite of what we're really trying to do. And so that would just be my comment for the day, I guess. Thank you for your time.
Thank you, Eric. Any commissioners have any questions for Eric? No? Any other public comment? All right, not seeing any. Do we have a motion?
Madam Chair, I move to initiate rulemaking proceedings for further discussion.
Second.
All right, it's been moved and seconded. Is there any further discussion? Okay. All those in favor say aye.
Aye.
Aye. Aye. All right, motion passes. Thank you. We will now be going into executive session for 2.5 to 3 hours to discuss current and potential agency litigation with legal counsel, including tribal negotiations. Thank you.
Wait, Chair, before you close, the last item on the agenda is public comment.
Oh.
As a special meeting, we must.
Right. Is there any additional public comment first over anything we've done today? No. All right. Now we will go to executive session and we will come back to adjourn for the day.
Recording is started.
All right, that takes care of our agenda items for today. It is now 1:16 p.m. The next Gambling Commission meeting will be held at the Gambling Commission office in Lacey on April 25th. We are adjourned.